very good evening to you. I'm Smriti Vidyarthi and this is County Focus. Tonight our focus is of course on the coronavirus pandemic. Now each day the number of cases rise and today, Monday the 4th of May 2020, Kenya's cases have increased by 25, bringing the total number of cases to 490, just shy of 500. Well, Nairobi County has the highest number of cases, but cases in other counties are growing too. Well, tonight we zoom into Kiambu, which is reported to be one of the counties worrying the National Committee combating the virus, partly due to its proximity to Nairobi. Now, its cases stand at 4 currently after one person succumbed to the virus in that county. But Kiambu has swung into action to mitigate the spread of the coronavirus. And joining us live from Kiambu is Governor James Nyoro to discuss the county's preparedness, preventative measures and post-COVID. Governor, good evening and welcome to NTV.
Good evening to you. How are you?
Very well, thank you, given the circumstances. We appreciate your time. Now, I'll start by asking you, how prepared, on a scale of 1 to 10, 1 being the lowest, 10 being the highest, would you say Kiambu County is to fight coronavirus cases?
Well, 7 if not 8, and I can explain why.
All right, we'll come into why, because indeed your county is taking measures and 7 to 8 is a rather high number. During this time, Governor, of course, people need to eat. So we will be discussing issues of food security as well. But they need to access food markets as well. One of the measures that you are taking is to close and fumigate markets and then reopen them under new guidelines. Tell us a little bit more about this.
Thank you very much. So we've been having three pillars in combating COVID-19. One, of course, is preparedness, which we'll talk about. The second one is prevention. And the third one is livelihood. So what you have asked me is to do with prevention. So what we did was we first closed our markets because we realized that immediately after the COVID pandemic got to us, most of our markets were very crowded, including the people who were coming to the market and the sellers. So we closed the market specifically to do 3 things. One was to fumigate. We wanted to make sure that we have fumigated everything. And then after the fumigation, we also wanted to install water, hard washing facilities. As you know, Kiambu County, we have 7 water companies, water and sewage companies. And what we did was we gave them instructions that in the areas of their operation, they have to make sure that they have installed hard washing facilities with soap. And where soap was not available, we made sure that we had sanitizers. So that was the second reason we closed the market. The third reason why we closed the market is to make sure that when they came back into the market, they would be observing social distancing. So what we did was we marked the points of sale and we marked the points of traders who come and buy. And then we organized in some places like Juja, we made sure that there is only one gate to come in. And people would be queuing and then they would hard wash and then they would enter into the market and they had instructions not to spend more than 5 or 10 minutes. You go in, you buy, no stories, and you come out. And we've seen a lot of progress as far as that is concerned. And occasionally then, of course, we are closing the markets to fumigate at night. So that was what we've done as far as markets are concerned.
Well, Governor, we know that some of the measures to fight the coronavirus are as simple as hand washing and observing social distancing. But what's been seen on the ground across the country, and no doubt this includes your county as well, is ignorance, defiance and simple lawlessness. You have said that some of those actions that you've taken in your county are indeed working, but what are you doing to ensure that residents adhere to this strictly? Because it is a huge concern that people are now simply going back to normal.
Well, there's a problem, as you probably, just like you have said. Generally, I think people are feeling like COVID is past us, which is not true. So what we are saying is, and we have said it very categorically, that if we find a market that is not observing those three regulations in terms of hand washing, because we continue to provide water and soap, if people are not putting on masks, if people are crowding closer than the required distance, what we have said is that we are going to close the market. When we close the market and we make sure that they don't sell on the streets, it is them who are going to lose. And therefore, that is one of the things that we are doing. Of course, we are also doing a lot of education. I think you probably see a lot of ignorance. I have to say that I was very impressed by Ruaka, because after the incidences in Ruaka, and we saw that Ruaka could have become a hotspot, and we closed the market and we declared the building where there were those patients. We closed it and declared it as a quarantine for a period of 4 days. And by the time that we tested all the 88 people, and we found that all the 88 contacts were negative, by the time we went back, we found that there was a lot of change. People were observing the distancing, people were putting on masks, but it has actually slowed down, as you are saying. If you look at traffic, even around Kiambu, you will see people behaving like life has gone to normal. And I'm hoping that the national government will have to come back here. Because if you look at the situation that is in Kawangware, Kawangware is very close to Odero, and Odero is close to Kikuyu. And Kikuyu, of course, is one of the centers that is equidistant in Kiambu. So it's a bit worrying, but I think people are getting it, but getting it a bit slow.
All right. Well, one of the preventative measures that you've taken to fight the virus is to set up COVID isolation centers in your level 5 hospitals and also the Thika level 4 hospital. Oh, I beg your pardon, Tigoni level 4 hospital. How exactly are you doing this?
So that is our pillar, the pillar that we call preparedness. So what happened was, immediately the pandemic, there was an outbreak. We quickly moved to ensure that we have isolation beds. And so far, I have to say, out of our 3 level 4 hospitals, that is Gatundu, Thika, and Kiambu, we have a total of 60 isolation hospitals. Now, what we also did was we moved the patients out of the hospital. Normally, the outpatient or OPD, they would be seen inside the hospital. But what we did, like for Kiambu, we moved the patients completely out. We pitched some tents, and what we did at the gate was to put in somebody who would be screening for a temperature, and then, of course, close observation. But they would not be allowed to enter into the building unless they are going to see the doctor. So we managed to control the crowd inpatients. We made sure that people who are visiting are not necessarily coming to crowd. In fact, what we did was to ask the patient, who would you want to come and see you, instead of everybody coming. So we managed to have the isolation, and we also managed to keep some of the people, of course, out. I must say that this has been very impressive because so far, although we have had a screening of about 172 patients, none of those have shown any positive sign of corona or COVID-19. The only cases that we are having are the cases that were in Ruaka. But we realized that that was not sufficient. The level 5 hospitals, we can only maintain 60 beds. But if you get a patient, then you start to share some facilities. So if the patient, for instance, would want dialysis, you would share the dialysis machine with the non-COVID patients. And it was on that kind of strategy that we thought, why don't we have one dedicated facility, which luckily for us, we had Tigoni. You know, Tigoni Hospital is a very interesting hospital because, first of all, it is isolated. It's not within the populated area. Okay. But also, we were lucky because there was a building that had been stored before I came in, and we hastened the construction of that building. And it was to be completed end of this month, but we hastened the completion. And now we are at a point where by the end of this week, that facility will be totally dedicated for COVID patients.
All right.
Initially with a capacity of 60 beds, but we will move on to another 100 beds.
Okay, well, that certainly is good progress, and there is still more that your county is doing to fight this deadly virus. We've got to take a quick break, but when we return, my conversation with the Governor of Kiambu, James Nyoro, continues. Stay with us. Kiambu continues now. Governor James Nyoro, about 1,700 medical personnel have been trained in your county to deal with patients who have been affected by the coronavirus. But now medical personnel across the country have issued a nationwide strike. Governor, can you hear me?
Yes, I can hear you now.
All right. I'll take that again. Over 1,700 medical staff in your county have been trained to deal with patients who have been dealt with this coronavirus. But at the moment, health workers across the country have issued a strike notice, and their concerns are that the government currently does not care enough for them. One of their concerns is that they don't even have the right personal protective equipment. What is the status of the health workers in your county? Are they equipped?
First, I would want to thank our medical personnel because they've done a fantastic job. As you probably said, we have about 1,700 trained, and they have worked extremely hard, and I really would want to thank them most sincerely. What we have done is that we have made sure that we have enough supplies in terms of PPEs. Right now, we've ordered about 5,000 PPEs. We have enough N95, which is masks that they normally use, and we also have the surgical masks. We, in addition to that, have a lot of non-pharmaceutical and pharmaceutical for COVID-related conditions. So we, as far as our staff are concerned, and then of course what we did was that now that everybody is working from, most of the people are working from home, so we took all the vehicles that were used by ordinarily by people working in the offices outside the medical, and we made those vehicles available to our medical team. We also made sure, because there was this discussion with COG, with SRC on whether they should be given allowances or not. What we did on our side is to say what we are going to do is to allocate enough money for interest. So the allowances are paid, whether it is lunch allowances or practicing allowances or whatever it is. But in addition, they have money for transport. In some places we have also hired buses, school buses, to move them from the hospital to their residential areas. So as far as we are concerned, we are very, very happy and confident that our staff will not go on strike because probably they do not have the facilities. If anything, it will probably be issues that are completely beyond our control. And we continue to appreciate them. In fact, one of the things they have done, and I'm very, very happy.
Yeah, go ahead.
One of the things they have done, I'm very happy about this, is to establish a research unit. What we are doing is we are now monitoring the number of patients who are coming in non-COVID, who otherwise were not coming into the hospital. We are also studying, because this whole COVID-19 issue is very dynamic. You know, a few weeks ago, everybody was talking about ventilators. Now, what our staff are telling us is, let's make sure that we install bulk oxygen piped to every bed, because that is what we need. So they have actually gone beyond the normal duty to help us to become effective. So as far as we are concerned, and my staff who start with me, we are very, very comfortable in terms of surprise.
All right, you bring up the issue of ventilators, and of course, plenty of resources are needed to fight this pandemic. Has Kiambu County received equipment and resources from the Ministry of Health and or the national government?
Well, we have only received a few. I think we got some PPEs, we got some N95, but largely we have not received any ventilator. We have 6 ventilators because remember, Kiambu has an ICU in Thika with a bed capacity of 6 bed capacity and 6 ventilators. So those are the only ventilators that we have. We are buying more. We'll be buying more ventilators because remember, one of our activities is also to activate our 4 ICUs in our 4 facilities. So the one in Tigoni will have ICU bed of 14, capacity of 14 beds, Kiambu 10, Thika will have 10, and Gatundu will have 16. There we will have to have ventilators. But what we have been learning from experiences in Italy, experiences in the US and the UK, is that ventilators will probably not be what you need. What you need, like I said, is oxygen. And what we have done is we are now installing bulk oxygen into our facilities. Within the next 10 days or so, we'll have bulk oxygen installed into our facilities so that the patients will have access to that. So yes, to answer your question, we are receiving some supplies, not as much as we would wish. We also have placed some orders in KEMSA. We don't receive them in the way we would have wished. But we are also depending on other merchants to supply this to us. Like we always do, even when we order medication from KEMSA, we get some from other other merchants.
All right, Governor, believe it or not, we are almost out of time. So just a couple more questions. You raised these issues of what needs to be done and what hopefully will be done to equip hospitals to deal with this sort of a pandemic. Health, of course, is a devolved system. Do you agree that it has simply not been the government's priority from the get-go? Because, frankly, we are looking at a health crisis.
Well, let's put it this way. I think it would be unfair to say that it's not given the attention. From our own budget, about 35 to 40% of our budget goes to health. We have 2 other areas that are totally devolved, like agriculture. So I think the problem is that we have had very dilapidated health system over time. And COVID has been a wake-up call, both from the national and for the county governments. And I can tell you that once we are through, God willing, with this COVID thing, it will never be the same again. We are going to have first-class hospitals with ICU facilities, with monitors, with all kinds of dialysis and all those kind of things. Invest in other in other departments. So I think from our point of view, we are spending a huge amount of resources. But remember, we have 2.4 million people. Remember also that we get patients from Nairobi and other counties coming to us. So if you improve health facilities in one county and you don't do the same in the adjacent county, then the one that have improved will have a problem. So those we need to have, like for us in the metropolitan area, we need to have a policy of a medical metropolitan, kind of policy for those counties.
Certainly, the entire health system across the country needs a shift. Let me move to the focus of livelihoods and post-COVID, because we need to look at how to help those people who have recovered from this virus. What is your government doing to ensure livelihoods are secure during a time when business is bad?
So 3 things, Smith, that we are doing. The first one is we realized that if people do not die of COVID, they'll die of hunger. So we made sure that we had a seed distribution program We did it with the limitations of COVID, and we distributed 71 tons of maize seed and 35 tons of beans. That is now planted. It's raining luckily enough. So we are hoping that by June, July, we'll start to get some beans. And so that was the first one. The second one is food aid. We realize that we do have informal settlements, and we have, arid and semi-arid areas like Kindeya, Karai, Goliva, and Gatuanyaga. So we have mapped out those areas, and we have come up with the most vulnerable community. Luckily enough, we've been receiving food aid from a number of donors. You remember we as a county, we set up an appeal fund where a number of Kiambu people came in and said we want to help. This appeal fund is being operating under the patronage of Honorable George Muhoho and Chairman Eddie Joroge. So they are bringing in food. We are now developing a logistic committee to work with the county commissioners to distribute the food. Unfortunately, there has been a bit of politicization of food, and we would want people to keep off politics as far as food is concerned. So we will be coming out and giving out food. That is starting, and we'll see that increasing because we are increasingly getting more food. And we also buy some food if need be. The third one, which is most important, is to start to think about post-COVID recovery or within COVID recovery. As you probably know, there are quite a number of agribusiness entrepreneurs who are caught up. They could have been poultry farmers. Some had their chicken ready for slaughter, or they had eggs ready for sale, but the hotels were closed. And they have gone under. There are many others whose business has gone under. So what we are doing is we are working out a post-COVID economic recovery process and a strategy. We are working together with the Kenya National Chamber of Commerce. We are working together with banks. We've already established a relationship with a bank where our people will be able to borrow. And we are running away from this thing of a fund with a fund manager that you draw down. We would want to leverage on huge amounts of resources that are available from other banks so that it can be borrowed by small and medium enterprises, the macro enterprises, but also from startups. There are people who from now would start doing aquaculture because you can do that from home. Right. You can do kienyeji chicken. Okay. You can do that. So that's the kind of thing that we are looking at for economic recovery after COVID.
All right, great plans there that certainly will help the millions of people that are facing tough times with regard to their business. My final question, Governor, because unfortunately we are out of time. The national government has embarked on mass testing in various areas that they consider hotspots. But this mass testing is being defied. People aren't taking so well to it, possibly because they are concerned that if they are found positive, they will be subjected to quarantine. And we have reported cases of certainly poor quarantine facilities. How will you encourage your people of Kiambu County to go ahead and get tested?
Well, we would want to encourage our people. In fact, I have requested that we do some mass testing, particularly in transit areas where we have vehicles going to Mombasa or picking some produce from Kiambu. But our people are waiting. I think the worst thing that you'd want to do is to enforce a decree that everybody must be tested by force. I think we have to make an appeal. We have to do some civic education. We have to tell people, just like HIV, that once you know your condition, you are better than if you don't know your condition. I think to me, it's largely going to be education and appealing to people to do that.
Well, thank you so much.
But finally, I know we've run out of time, but I would want to say that the committee I talked about that is helping us to fundraise is Kiambu for Kiambu people. It's Kiambu people who are reading it, and we are being very, very careful in distinguishing what we do with the funds raised from the committee, from the funds that we have in the county. They have already appointed one of the big auditing firms to come and audit for accountability and transparency. But we want to appeal to people of Kiambu to come, help us, help other people other Kiambu people and even generally Kenyans. We really appreciate if they can do that.
Course, be our brother's keeper. All right, Governor, that's all we have time for. Much appreciated. Thank you so much for joining us on NTV, giving us insight into what Kiambu County is doing to boost its capacity to fight the coronavirus. Speaking to me live on NTV from Kiambu, Governor James Nyoro. All right, well, that's it on this edition of County Focus. Expect more of them on NTV. We leave it there for now. It is 8 o'clock. Do stay tuned and join me at 9 o'clock for NTV Tonight. I'll bring you up to speed with the day's top stories.